Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Communicable diseases dominate Uganda's disease burden, which account for over 50% of morbidity and mortality. The ailments include cancer, kidney, liver and heart diseases, which usually require specialized treatment. The Ministry of Health has since embarked on improving healthcare through upgrading, equipping the existing hospitals and health facilities, but also putting more emphasis on specialized treatment. But the specialized hospitals may not perform to their desired goals, and here is why. More than a year after its commissioning, Mulago Specialized Women and Neonatal Hospital is struggling to provide services to the public.
This hospital attained VOD status on 1st July 2019. So as we speak, it's almost 6 months old.
The 450-bed capacity hospital in Mulago was completed at a cost of approximately $25 million or 92 billion shillings, thanks to a loan from the Islamic Development Bank. The loan was also used to finance the training of health workers in specialized maternal and neonatal areas where there were skills gaps.
We are hoping that we'll be getting a maternal fetal medicine fellowship soon. Already we have an ongoing gyne oncology fellowship. The fellowships, the advantage is that they are hands-on. There's a lot of work that goes on. So it's not just reading books, but a lot of work, which helps with the patients, but also helps the specialists get those skills. Okay? So with more of those fellowships, with opportunities for staff to go for more training, we believe that we'll be able to attract and gain confidence of our Ugandans and also people from the region.
More to that, $8 million or 29 billion shillings was used to equip the hospital with imaging machines, DNA laboratories, hematology and chemistry analyzers. The institution also has capacity in in vitro fertilization or IVF and hemoglobin electrophoresis equipment, laparoscopy, hysteroscopy, surgical sets and facilities for endoscopies and critical care equipment like ventilators, defibrillators, patient monitors, among others.
Antenatal attendance has increased by is at 54% of what we had in the previous year. So this is just 1 quarter, showing you how high it has improved. Immunization has improved, is at 98.6%, which is much higher. Laboratory services have also increased, and the total increase in ultrasound is 39.1%, in mammography 84.6%, in laboratory 53.1%.
Despite this heavy investment, the acting director of the hospital, Dr. Evelyn Nabunya, says they still have less than 50% of all the specialists required for the facility.
Up to now, we have 32 specialists. These are few. They are quite few for the amount of work that we do. So we still have some support from Mulago National Referral Hospital in areas like radiology. We also have the intensive care unit operating here, so we still have them to mentor our staff and to build capacity as well.
This includes those for critical procedures in theatre, like in vitro fertilization.
Our staff structure, currently the approved structure, has 880 staff. So you can see that we are at less than half of the staff that is required. And even in the different areas, there are very few. There are areas, for example, that are difficult to fully operate. For example, the theaters, we have a total of 10 theaters, but currently only 4 can operate because of the limited human resource. Okay? So in areas of anesthesia, in critical care, in NICU, we need more staff. And also other areas like the IVF, this is a specialized, it's one of our most specialized area. This is new in a public facility in Uganda. It has not been offered before. So there is a different level of specialty that is required. So we are in the process of getting those. I know there are some that went for training, some short trainings. but there is a plan in the next financial year to be able to send out people for long-term training. Not enough for us to bring in those other specialists that we need. So in the next budget, we expect that we should be getting more wage to be able to bring in specialists. For example, take more wage, and we need them. At least the nurses, we are not very badly off, but the doctors are very few.
The institution is also troubled by the matter of pricing for care. Even after a public outcry of the cost, the price list was revised, but not everyone feels that it is an affordable public facility. Services in reproductive medicine go for between 13 to 14 million shillings, with consultation fees set at 50,000 shillings per patient.
Really, to have cost recovery, to be able to maintain this building. This is a state-of-the-art facility which needs to be maintained. So part of that is for maintenance of the services, and also to make sure that the health workers are well catered for.
The hospital currently runs on a 14 billion shillings budget for both wages and operations, with a shortfall of about 38 billion shillings, and has no development fund. Once completed, it is estimated that Mulago Specialized Hospital will require almost double of what the Women's and Neonatal Hospital requires.
So things like transport, ambulance and all that become difficult. There are certain equipment that we need and we are not yet able to get. Okay, furniture, this is quite a big hospital, so there are areas where some things are still missing. So, you know, in any new facility, you expect development to occur, but we are putting in our request, and we hope that Ministry of Finance will be able to do the needful.
Last year, the Health Ministry did not achieve its promise to have Mulago Hospital reopened to the public, despite the urgent need for critical care in the country. Walter Mwesigye, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.